So I have a few objectives for my talk today. I'm going to begin with just talking about how we can define smoldering multiple myeloma and high-risk smoldering multiple myeloma. And I'm going to be talking about the treatment options for patients with smoldering multiple myeloma, and lastly, touch upon some lifestyle interventions for these patients as well. So, in terms of what smoldering multiple myeloma is, multiple myeloma or plasma cell disorders occur across a spectrum. So there's a B cell in the bone marrow, which is called the post-germinal center B cell, which acquires some mutations, gains some clonality and develops something called monoclonal gammopathy of undetermined significance, or MGUS. MGUS is the first precursor state, and essentially this spectrum consists of increasing number of plasma cells and symptoms. So MGUS patients have the least number of plasma cells, actually by definition less than 10% in the bone marrow, and they have smaller M spikes, which is the monoclonal protein which we check in the peripheral blood, as well as less protein in their urines as well. And apart from that, MGUS and smoldering multiple myeloma patients do not have adequate number of plasma cells that is suffice to cause symptoms in our patients. An intermediate stage between MGUS and multiple myeloma is called smoldering multiple myeloma. These are patients that have a lot of plasma cells, but not enough yet to cause symptoms. Essentially, if you have 10 to 60% of plasma cells in your bone marrow, you do have smoldering multiple myeloma. At the same time, you have a higher M protein, a higher free light chain or a lower free light chain ratio, and more proteins in your urine. When you have multiple myeloma, you now have disease, you definitely need treatment. You do have symptoms now from this disease. So why I'm talking about smoldering multiple myeloma and why it is a controversial topic is because it is, at the end of the day, a heterogeneous disease. While we know that there is a progression from MGUS to smoldering to multiple myeloma, the genetic framework of these three disorders are oftentimes similar. But there are other factors, often called host factors, which could be responsible for the progression of the disease from MGUS to multiple myeloma. While at the smoldering stage, some of these cells might act like MGUS, and some of these cells might actually act aggressively like multiple myeloma. So while they might be meeting the diagnostic classification of smoldering myeloma, some of these might biologically act like MGUS cells, some of them biologically act like stable cells, and some of them biologically act like multiple myeloma cells. Based on how active these cells are, we could have different treatment options for these. For example, patients who act like MGUS could just be observed over time. Patients who have more stable disease could undergo some preventive treatments to prevent progression to multiple myeloma. And patients who are already biologically identical to multiple myeloma cells might benefit from early treatment.